So how personalized is the treatment in Chinese medicine? Would two people with the same type of cancer receive very different care plans?
You know, Chinese medicine, off, specifically in our medicine, Chinese medicine, is never the same treatment for this for two individuals, even if they have the same presentation. It's just not, because our constitutions are very different. So whether it's cancer or any type of conditions, it would not be the same anyway. With that said, cancer patients oftentimes have similar problems, right? Like we talked about it, fatigue, neuropathy, and all these things, right? Sometimes they have loose bowels because of radiation and all the other stuff. But the constitution, the individual constitution matters. And I think this is what makes Chinese medicine so effective, is that we assess the individual and then we cater that treatment to that constitution. That's why it's so much more effective, right? To prevent, right, or minimize some of these side effects.
What is a constitution?
You know, their makeup and the state of how well they are. Where someone has very more yin deficiency, we're going to use Chinese medicine language, right? I was more yin deficiency, more drying, for example, right? As opposed to someone who's not. So these things all come into play. And this is why the Chinese medicine is so effective, because we find out what the body's imbalances are, and we address that imbalance, and we allow the physiology, the body, to rectify itself, right? Where in Western medicine, we don't really care that much about the body. We know what the chemical pathway is, and then we block that pathway, and that's how we rectify things. But that's very downstream, but the upstream physiological, you want to say imbalance or deficiency that's causing that, is never addressed. So we only address the symptoms very well, but the cause in Western medicine, but the cause we don't really address. And I think it's really at the crux of all this, is that Chinese medicine addressed the root of the imbalance. It may be a little bit slower, but in Western medicine, we address oftentimes the extensions, right? With the signs
Yes.
and the symptoms. And we're very good at that, but we're not very good at addressing the root of the problem. A combination of the two would be amazing.
So you think Western medicine and Chinese medicine can coexist?
They do. In China, they do. In Korea, they do. In Japan, they do. It's all, and you know what? To some extent, in the United States, they do as well. But there's a lot more
That could be done.
that could be done, right? And it takes time, right, for the oncologists or the Western doctors to be more understanding of Chinese medicine and how it works.
I mean, I think it's opening up. Even though I've been in practice for 14 years, there's huge changes, even in sports medicine.
Absolutely. A case in point is maybe a couple of decades ago, there's no acupuncture department in hospitals. Now, you'd be hard-pressed to find one that doesn't have a department of acupuncture.
That's
right?
amazing.
So it's a matter of time, and it will change. You see the model working in other countries. Why not?